If you do this, anesthesia on the day of the procedure will not work on you. You have to follow the pre-operative instructions to have a comfortable hair transplant procedure. How to ensure a pain-free procedure, that is the topic of the day. So what is local anesthesia? So local anesthesia is defined as localized numbing of the target area, which is the recipient area and the donor area in this case. Most patients do not require any IV sedation, any sniffing of laughing gas. Most patients are very comfortable with local anesthesia. But then there are variations, and to these variations are added patients who do not follow pre-operative instructions, and this routinely happens in hair transplant surgery, causing undue anguish both to the surgeon and the patient alike. Since no two tissues are similar, no two patients are similar, the body processes anesthesia in a manner which is unique to you and unique to your tissue. For example, redheads require more anesthesia than non-redheads. People with red skin which is prone to acne formation, require more anesthesia, and they require more waiting between administration of the anesthesia and the start of the procedure. And then there are some in which the numbing agent is excreted or removed of the body faster than in the others. And though controversial, in some it is reported that patients have resistance to anesthesia. That is, anesthesia wears off even before the procedure starts. But this is pretty controversial because many doctors do not feel that resistance to anesthesia exists. We will talk about this anesthesia resistance later down in this talk. 30.45% of the patients who are eligible to get a hair transplant done and who are craving to get a hair transplant done shy away from a hair transplant merely because they are anxious about anesthesia. They have a phobia about needles. Most of them have had bad experiences with the dentists when they were children, gone to a dentist to extract a tooth, and this experience remains ingrained in their mind for a long period, and it manifests itself when they reach a hair transplant clinic. Though hair transplant physicians as a community are far friendlier than dentists, it just does not seem to help. So patients might just be very anxious, in a hyper anxious state before the procedure, and the tiniest of touch stimulus may be interpreted by their brain as pain. But most of the times these people have pain because they do not follow up on the pre-operative advice before the hair transplant procedure. And this casual attitude is more often seen in young people who are adventurous and who are casual, more likely to be party animals, partying late into the night previous to the hair transplant procedure. They feel they are going to a salon for a salon treatment, not realizing that though minor, a hair transplant is a full-blown surgical procedure. So there are certain do's and don'ts which the clinic will send to you, do's and don'ts that will make you less anxious on the day of the procedure, certain measures which will help in calming your raw nerves and lead to an ultimate smooth and pain-free procedure. So these are 5 points, 5 cardinal points, which if followed will help you have a smooth procedure and a smooth recovery after the hair transplant procedure. Number 1, a sound sleep the night before the procedure. You should go to bed at 10 p.m. because most procedures start in the morning at 7. No traveling long distances to reach the clinic, especially for those who are from out of town. Last minute traveling involves rushing. More often than not, you are always late for the procedure, and rushing will increase your stress levels. So you should try and reach the clinic 1 hour before and stay in the city of the clinic the night prior to the procedure. No alcohol should be consumed the evening prior to the procedure, and so is the case with coffee. And please do not scratch your head starting 7 days before the procedure so that you don't get any infection. Now I will deal with these points one by one. You need to be well rested on the day of the procedure. A tired body and lack of sleep makes you very irritable. The slightest of touch makes you feel uncomfortable, leave alone the prick of a needle. Stress-induced hyperlgsia can be associated with potentiated adrenergic sensitivity of primary afferent fibers as a result of upregulation of alpha-2 adrenergic receptors and exacerbation of neurogenic inflammation by alpha-1 adrenergic receptors. If you feel anxious before the procedure, this may affect how you respond to anesthesia, for your body tends to interpret even the slightest of touch as pain. Though it is always a better idea to be well rested, sleep well the night of the procedure, this can be treated through inhalational anesthesia, nitrous oxide, or by IV sedation, but it's always best for overall safety of the procedure and speed of the procedure that the patient is awake throughout the procedure and cooperative. A stress reduction protocol in consultation with the clinic is vital for a smooth hair transplant procedure because stress increases pain by 30.9%. The body's alcohol content may slow down the action of local anesthesia. It may need larger amounts of local anesthesia to be administered, and this may restrict the length of a session, especially if you're undergoing a mega session. So in spite of one day, you might take 2 to 3 days to complete the same session. Moreover, any form of surgical procedure involves some amount of bleeding. The body reacts to it by clotting, and alcohol is a blood thinner. It delays clotting mechanism. Therefore, it may interfere with the FUE hair transplant procedure, causing difficulty in both harvesting and plantation of grafts. We all know coffee is known to interfere with cognitive brain function. Coffee causes increased heart rate, increased wakefulness, poorer sleep, and anxiety in most cases before the procedure. And this may cause anesthetic failure. Therefore, it is advised to abstain from coffee 48 hours before the procedure. Now, do not scratch your head in any manner, consciously or subconsciously, starting 1 week before the procedure. For scratching can cause minute skin disruptions which can lead to infection, clinical or subclinical. Infection, if it happens, causes the buildup of acid in the tissues. This acidic pH prevents the action of local anesthesia on your nerves. So in the end, I would like to say a few words about resistance to anesthesia. Many doctors will not believe in the truthfulness of the statement that there are patients who are just resistant to local anesthesia. They do not believe that anything like resistance to anesthesia ever exists. But those who administer anesthesia routinely, like in my clinic, around 0.1% of patients, that is 1 in 1,000 patients, are recalcitrant to local anesthesia. It is very difficult to anesthetize these patients. Now, what is the reason that they are resistant to anesthesia? Clendenin and associates discovered a genetic defect that causes this resistance. They discovered that these people have a specific sodium channel in their bodies referred to as sodium 1.5. The affected gene called SCN5A produces a protein called NAV1.5, which is a major component of this channel 1.5. And this is called, according to the study, a MISSENSE mutation. It means that one of those amino acids in the protein is different in people with this type of genetic quirk. However, it is not exactly clear what difference is caused by having this mutation, but it could more likely make these sodium channels remain open, allowing pain signals to travel to the brain despite the application of local anesthesia. So this is about pain, how to prevent pain on the day of the procedure, following the do's and don'ts, the list of do's and don'ts sent by the clinic, following medical advice towards a smoother hair transplant procedure. A smooth hair transplant procedure is good both for the doctor as well as the patient he is treating. So thank you for watching again, and let me know if you have any questions and I'll be happy to answer. Till the next video, God bless you.